Today we are going to talk about autoimmune disease. What is the autoimmune disease? Examples of autoimmune disease, causes, and treatments. First, we had to define what's meant by autoimmune disease. Autoimmune diseases are a group of disorders caused by immune reaction against the own body tissue. Mean that the immune system itself and its components going to attack the tissues, the cells, the organs of the body, causing damage. This damage can start with inflammation, and this inflammation can end with permanent damage, tissue damage, or dysfunction of the organ. Autoimmune disease occur due to breakdown of mechanisms that maintain autotolerance, meaning that every cell in the body considered in the beginning as an antigen, and these antigens develop a tolerance in the body to its own antigenic determinant. And if this tolerance or autotolerance destroyed, this results in development of autoimmune disease. Autoimmune disorders are diverse group of conditions which occur due to abnormal stimulation and signaling with the immune system, meaning that self versus non-self recognition is altered. By meaning that the immune system going to recognize the self antigen as non-self and start to reacting according to this concept. Autoimmune response occur because of, for some reason, actually the reasons is unknown. T helper cell recognize cells of the body or self antigen as a foreign and mark it for destruction. What is the causes of autoimmune disease? Actually, the actual cause of autoimmune disease is unknown, but there is some predisposing factors that help in develop of autoimmune disease. These causes or predisposing factor first is genetic predisposition. Like some families develops autoimmune disease, certain autoimmune disease, like rheumatoid arthritis. Most of them appear associated with certain major histocompatibility genes, especially major histocompatibility type 2 genes. For example, rheumatoid arthritis, thyroiditis, multiple sclerosis, and systemic lupus erythematosus, and type 1 diabetes mellitus. The second predisposing factor is exposure to infection. Some infectious antigens that cross-react with self-antigen, meaning that the antigenic determinant of these infectious agents resemble some of the self-antigen. This confuse the immune system and results in attack of the immune system to its own self-antigen. For example, like M protein. M protein is secreted by Streptococcus pyogenes, which causing septic sore throat, especially in children, and may react with heart valve causing rheumatic fever. Usually, for that reason, the frequency of infection with Streptococcus pyogenes should be considered, especially in children, because frequent infection with Streptococcus pyogenes can result in development of rheumatic heart fever. Third, alteration of some self-antigen or appearance of new antigens under the effect of drugs, meaning that this is drug-induced autoimmune disease. Like some chemicals, some drugs, some viral infection can induce autoimmune disease, especially under some circumstances like exposure to sun and UV. Fourth, hormonal, hormonal influence play role in systemic lupus erythematosus, for example, because we can see that systemic lupus erythematosus infect women 9 times more than men. And usually it comes in the age of childbearing age, meaning that when the woman comes pregnant frequently, about 30s and 40s, start to raise systemic lupus erythematosus, some of them. What is the classification of mechanism of autoimmune disease? Actually, the autoimmune disease classified according to the type of the immune response, meaning that if the immune response is specific for certain organ, we called it organ-specific autoimmune disease, like Hashimoto thyroiditis. Others is non-specific or non-targeting specific organ, like systemic lupus erythematosus and rheumatoid arthritis, which spread all over the joints. And also systemic lupus erythematosus is also affecting the basal membrane of the small blood vessels all over the body. So we call it non-organ specific autoimmune disease. We can also classify the autoimmune disease according to the mechanism of tissue damage in the autoimmune disease, and this is resembling the same classification of hypersensitivity. So we have type 1 and type 2 and type 3 and type 4. And this is different, most of them are different in the mechanism of tissue damage. The mechanism of tissue damage in autoimmune disease, either through complement fixation, like hemolytic anemia in type 2 hypersensitivity, or formation of immune complex resulting in deposition of this immune complex in the joint or kidney or skin or on the basal membrane of the small blood vessels, fixation of the complements resulting in stimulation of the complements and activation of the complements, which are going to end with destruction of the surrounding tissue. And this is happening in systemic lupus erythematosus and rheumatoid arthritis, like type 3 hypersensitivity. Delayed type reaction, which is type 4, this is happened due to activation of T cells, like in case of ulcerative colitis or multiple sclerosis and type 1 diabetes mellitus, which results in destruction of islet of Langerhans and destruction of the pancreatic cells. First, we're going to discuss organ-specific autoimmune disease like Hashimoto's thyroiditis. In case of Hashimoto's thyroiditis, there is autoantibody production targeting or directed against peroxidase and thyroglobulin, so resulting in binding with peroxidase and thyroglobulin. This will result in formation of antigen-antibody immune complex and leads to activation of the complement, which end with destruction of thyroid cells. The other type of thyroiditis is thyrotoxicosis or Graves' disease. In this disease, excessive thyroid activity happens due to production of autoantibody directed to the receptor of thyroid stimulating hormone receptors. Binding with this autoantibody with thyroid stimulating hormone receptor results in overactivation of the thyroid. Actually, in both Graves' disease and Hashimoto, superactivation of the thyroid gland will happen. In case of Hashimoto, will result in true deficiency of T3 or T4 and resulting in excessive production of thyroid stimulating hormone. While in Graves' disease, the overactivation of thyroid results from overstimulation of thyroid stimulating hormone receptor. We can see here photo for a patient suffering from Graves' disease, and we can see that there is enlargement and hyperactivation of the thyroid gland. It also noteworthy to say that the Graves' disease incidence in female is more than male, and this is confirms the previously discussed predisposing factor, hormonal predisposing factor of the autoimmune disease, as it is associated with female gender. And also we can see here changes in the eye to increase the orbital pressure. We're going to discuss also here the multiple sclerosis, which is type also of autoimmune disease of the central nervous system, and it happens due to production of autoantibody directed against the myelin sheath of surrounding the nervous axons. Actually, this results in neuritis and inflammation of the neurons, and also misconduction of the neural or nerval signals. This will activate complement and develop inflammation reaction around the neurons. It also affects the central nervous system and the neurons. We can see here this photo that's myelin sheath surrounding the axon of the neuron is eroded, and there is some type of inflammation and destruction of the myelin sheath. Also here with electron microscope we can see the destruction of the myelin sheath in case of multiple sclerosis. Myasthenia gravis is another autoimmune disease, and this is a disease of the skeletal muscle which characterized by abnormal fatigue, extreme weakness after mild exercise, and ends with finally collapse. It results from destruction of acetylcholine receptors due to binding with autoantibody with the acetylcholine receptors, which hindering the transmission of the neural signal. And we can see here, this is the autoantibody start to bind with the receptor of acetylcholine receptor, blocking these receptors and hindering the transmission of the nerval signals. And we can see here in this eye, this is the eyelid, is relaxed all the time, and this is due to there is no stimulation or nerval stimulation that can transmit signals. If we discuss here the other class of autoimmune disease, which is non-organ autoimmune disease, meaning that this is autoimmune disease affecting all the tissue all over the bodies, or most of the tissue all over the bodies, and may located in any organ in the body. First example which we have, and the most widely example, is systemic lupus erythematosus. It is most commonly known autoimmune disorder. Yes, this is true. It's characterized by butterfly. This butterfly is actually, it is rashes, small rashes, start to extend it and making the shape of the butterfly on the nose and checks on the face. Systemic lupus erythematosus is usually fatal autoimmune disease, and the sequelae is known. It is more predominant in female than male. Actually, it comes in certain age, and this is also confirm the hormonal predisposing factor of autoimmune disease. Actually, systemic lupus erythematosus results from formation of anti-anti, meaning that the immune system itself makes autoantibody against its own antibody, Fc portion of the immunoglobulin, and bind with it and cause anti-anti binding, which make antigen antibody immune complex. And this is immune complex after time going to settle down and precipitate it on the membrane of the small blood vessels, especially in the skin and joints. This precipitation of antigen antibody immune complex results in stimulation of the complement by classic pathway, anti-activation of the complements ends with C9, and activation of the neutrophil and other macrophage cells, which results in also releasing of immune mediators, which are going to destroy and dissolve the antigen antibody immune complex. But the problem is not the clearance of this. This is happen usually in the body, but if it's happen in a large amount in different part in the body, this is going to destroy the small blood vessels, ending with destruction of the basal membrane of the small blood vessels, and starting to appear small rashes. Not small rashes. This actually starts with petechial hemorrhage under the skin, in the kidneys, and in the different organs of the bodies. These petechial hemorrhage going together, larger and larger, larger and larger, and going to make this rash. Actually, these butterfly rashes usually appear in a 40% only of the patient suffering from systemic lupus erythematosus. The other 60% not show these symptoms. Which organ are affected with systemic lupus erythematosus? Actually, many organs and systems can be involved, like joints and muscle, causing arthritis, skin, and this causes erythematous rashes like butterfly, kidneys, causing glomerulonephritis, lungs, pneumonitis, heart, myocarditis, eyes, retinal vasculitis, and corneal ulcers, Sjogren's disease syndrome. Gastrointestinal system, we have gastrointestinal tract ulcers, but this is uncommon. Vascular system, small vessels vasculitis, and this is common. Central nervous system, and this is neurological and psychiatric symptoms. Actually, there is a remarkable news here for patients suffering from systemic lupus erythematosus. They usually have a psychiatric condition as an episode during the course of the disease, and actually the main cause is unknown, but it is a remarkable note. The other non-organ specific autoimmune disease is rheumatoid arthritis. The autoantibody is directed against immunoglobulins epitopes. In systemic lupus erythematosus, it is directed against Fc portion, but here is directed against Ig epitopes. The immune complex deposit in the joint. The others, the autoantibody is directed against the body DNA itself in the case of systemic lupus erythematosus. But in case of rheumatoid arthritis, it is directed against the epitopes of immunoglobulins. And in case of systemic lupus erythematosus, there is spontaneous destruction of the cells and spontaneous release of the DNA, and this is results in spontaneous production of autoimmunoglobulin against the double-stranded DNA. But in rheumatoid arthritis, the condition is different, as this is autoimmune antibodies directed against IgG. The immune complex deposited in the joint and activate complements. This activation of the complements in the classic pathway results in destruction of the joint and distortion of the joints. As we can see in this figure, there is destruction of the synovial membrane in different joints, especially in extremes, fingers of limbs. We can see that rheumatoid arthritis usually affects the small joint. But in rheumatism, it actually affects both large and small joints. Okay? Rheumatoid arthritis is bilateral, not unilateral. Rheumatism can be bilateral or unilateral. Okay? The shape of the rheumatoid arthritis is different than that. There is a distortion of the joint, not only enlargement of the joint, but there is a distortion, can be shown in the x-rays. Here is a comparison between Graves and thyroid, hyperthyroidism, and Hashimoto disease, and insulin-dependent diabetes mellitus, and myasthenia gravis, and multiple sclerosis, and rheumatoid arthritis, and systemic lupus erythematosus. Which tissue is affected in Graves' disease? The thyroid. In Hashimoto disease, also thyroid. Insulin-dependent diabetes mellitus type 1 is the beta cells of pancreas. In myasthenia gravis, neurons, neuromuscular system. Not neurons, sorry, neuromuscular junction, resulting from binding with a specific antibody with acetylcholine receptor. In case of multiple sclerosis, here is the affected is the brain and myelin sheath. In case of rheumatoid arthritis, small joint usually. In case of systemic lupus erythematosus, is diverse. Which cells are involved in each one? Graves' disease, there is stimulatory antibody. Hashimoto thyroiditis, T cells and autoantibody. Insulin dependent, also T cells and autoantibody. In myasthenia gravis, autoantibody against acetylcholine receptors. In multiple sclerosis, there is T cells and autoantibody against myelin sheath. In rheumatoid arthritis, T cells also involved and the immune complex and autoantibody against Fc portion of the immunoglobulin. In systemic lupus erythematosus, there is autoantibody and the immune complex formation due to binding with autoantibody with double-stranded DNA of the body itself. How can we diagnose? The diagnosis is based usually on symptoms. In addition, detection of autoantibodies, and also we can use ELISA and radioimmune assays for detection of autoantibody, in addition to biological and biochemical assays. The treatment or the approach for treatment of autoimmune disease. Actually, here we can see that the autoimmune disease is developed as a result of abnormal activation of the immune system against the body, its own tissue and cells. First, we're going to use immunosuppressive agent, reducing activity of the immune system, but this leaves the body vulnerable and can be affected with opportunistic infection. Also used to prevent the body from rejecting the organ transplantation. So the first approach is using of immunosuppressant agent. The most common is cortisone. It is the first immunosuppressant identified. It is a steroid hormone discovered by Edward Calvin, 1950. Administered intravenous The side effect here is a pain, thinning of the skin, weight gain, abnormal distribution of fats. The second immunosuppressant is azathioprine, which is cytotoxic immunosuppressant drugs. It is prodrug, meaning that it's going to convert to another form in the liver, discovered by Roy Callan, inhibit purine synthesis necessary for proliferation of cells. The side effect is carcinogenic and causing some nausea and rashes. The third example for immunosuppressant is cyclosporine. It is non-cytotoxic immunosuppressant drugs discovered by Hartman, Stalin, 1972. Inhibits phosphatase activity. Side effect increasing with wide variety of other interact with wide variety of other drugs, causing some convulsion, peptic ulcer, and fever, in addition to vomition and diarrhea, confusion, breathing difficulty, numbness, tingling, and high blood pressure, in addition to kidney and liver dysfunction. The other approach is using of anti-inflammatory drugs. So first approach is giving immunosuppressants. Second approach is giving anti-inflammatory drugs. It can help in curing pain by reducing inflammation. Also, the groups is mostly steroids like corticosteroids, and the other group is non-steroids, like those affecting cyclooxygenase enzyme, like ibuprofen, aspirin, and naproxen. There is another group here is very important, is disease-modifying drugs, and these disease-modifying drugs improve symptoms, alter disease course, improve radiographic outcome, especially in rheumatoid arthritis. Examples for disease-modifying drugs like methotrexate, and this is usually used in treatment of rheumatoid arthritis. It is immunosuppressive, had immunosuppressive effect due to inhibition of enzyme involved in metabolism of folic acids, anti-inflammatory effect due to interruption of adenosine, relatively rapid onset action from 4 to 6 weeks can show some results. Side effect, it causes stomatitis and oral ulcers in addition to gastrointestinal upsets. And actually stomatitis is due to this immunosuppressant effect of methotrexate. The other example of disease-modifying drugs is etanercept, like Impril. It is recombinant DNA drugs, binds tumor necrosis factors in the circulation and that in the joint. So binding with tumor necrosis factor prevent it from interacting with the immune cells. So it inhibits the immune reaction against this inflammatory condition caused by autoimmune disease. It is usually subcutaneous injected. Side effect increased susceptibility for opportunistic infection, and this is known because of immune suppressant effect of Impril. Also, another example is Apticept. It inhibits co-stimulation of T cells, delays progression of structural damage due to inhibition of T cells. Side effect mainly back pain, cough, dizziness, and headache, and susceptibility for infection. We can see that all these examples of disease-modifying drugs, side effect usually common is the susceptibility for infection, and this is due to immune inhibition of the immune cells, either the immune reaction or the immune cells, or even the stimulation and the activation of T cells and the macrophage. This is some sources you can use for more results and for further reading. Thank you.